and I am a psychiatric mental health nurse practitioner. So I currently work at Avera and work with adults as well as senior patients and at times adolescent patients as well. Tonight we're going to talk about provider mental health and resiliency. I do like this to be a somewhat interactive conversation, so just know that if at any point you have any questions, please make sure to certainly ask me to pause, and I will be happy to answer any questions that I can. So tonight we're really going to focus on the concept of self-care and talk about those benefits, but I also like to talk about when we think about resiliency and taking care of ourselves, I think it makes sense to a lot of us why it's important, but I think a big piece of this is we have to talk about what are the barriers that maybe get in the way from us being able to take care of ourselves so that we can be more resilient. We also are going to practice then some self-care things that maybe we can even try in your everyday life. So to get started, one piece I like to call out is I think we all have to validate the fact that our world is very complex right now. New research reveals that Americans between 45 and 65 years old are experiencing more stress today than people did their age in the 1990s. And with that, the American Psychological Association, which is the association that I follow because it looks at mental health throughout our nation, says we are facing a national mental health crisis that could yield serious health and social consequences for years to come. And in your roles, I can only imagine that this probably speaks true to what you're seeing each day. And for those who maybe have done these services for more years are probably seeing what we see in healthcare, and that is there's a continuous increase in those who are struggling with mental illness. So let's talk then about why is that though? Why is our world more complex, or why are we more stressed? Well, one reason potentially is because we are now more connected to people than ever before. And in many ways, like an example tonight, our ability to connect over technology has many benefits. But with that, it also sometimes is making it more difficult for us to just pause and be able to take care of ourselves. I think about even like when I was growing up, when you were at a basketball game, you could literally just be present and enjoy that basketball game. Because when you got home at night, the answer machine had a list of messages of people who were trying to get a hold of you. But now kind of no matter where we are, there's this expectation that we're constantly available to others. In our work, we're now more connected to our work than ever before. And so, many people now can work from home. They can read emails from home. These are all in many ways good things, but with that, it also comes sometimes more expectations of being more available. We're also more connected on social media. And when you think about social media, my role, of course, is continuing to look at the research. And what the research does tell us is that there is something positive that can come from social media, partly because social media allows us to connect with others, and we know that is important for our mental health. But that's only one thing that they continue to show us that is positive. Instead, there's a lot of negative consequences that we know from social media. We know that at times, depending on how we use social media, we do a lot more comparison. And when we compare maybe our life to other people, that can sometimes lead people feeling more like they're depressed, or sometimes can lead people feeling like they're not as maybe good enough compared to other people when they look at other people's pictures, etc. That leads again to that increase in comparisons. And I give the example a lot when I think of even like my mom, when I was growing up. My mom every year helped us make Valentine's Day boxes. And my mom always felt like she had the best one that I presented at school. Well, I can tell you for a fact, because I was the kid who saw the other boxes, it wasn't the best one. But my mom never knew that. And that is so different than like today's world, where like as a parent, we're constantly comparing ourselves to the pictures of other people's Valentine's Day boxes. First day of school pictures used to be just standing in front of the house and snapping a picture. Now it's snapping a picture with a board that has beautiful handwriting that talks about everything this child wants to do when they grow up. And I'm not saying these things that we shouldn't be doing those things, but I am saying that what can happen with some of this is we really start comparing. I recently had a patient that talked about she felt like she had like a great 4th of July celebration with her family. She left it feeling great. Then she went on social media and started looking at other people's pictures of what they did with their families on the 4th of July. And she felt like, oh, my meal probably wasn't as good as theirs, or they had more people than we did. Again, sometimes that can lead to a lot more of those comparisons, which leads certainly to more stress. We've also seen a change in relationships and family dynamics, which sometimes has changed our ability to have like our support system be available to help us. We also see poor and infrequent stress-related mechanisms. So sometimes when I talk to people about self-care, they'll tell me that how they take care of themselves is after they shift, they go have a drink. Or after when they're really stressed, they go and indulge in Starbucks. When they take care of themselves, they go get a massage. Now, again, I certainly do not have these conversations because I want to cast judgment on anyone, because I myself certainly appreciate my Starbucks. But the difficult part with it is that, you know, if I told my primary care doctor that this year, to take care of my physical health, I was going to exercise once every 4 months, they would probably say back to me, that's good, it's better than nothing, but that is not going to maintain. And that's how some of us look at our mental health, right? That we're going to take better care of ourselves because once every 3 months, we're going to go get a massage, or once every 3 months, we're going to take some time for ourselves. If we compare that to our physical health, it would not be a surprise that, especially if we started to go through different life stressors, our physical health, our immune system is probably going to struggle. And the same thing happens with mental health. When we ask each of you, based off of what you see in your daily work, you see the amount of stress that you see. You go through, many of you go through a lot of traumatic experiences. When we look at kind of what we're asking your brain to go through because of the work that you do, if we're not proactive of making sure that we have some cup filling activities, if you think about it like that, we're going to struggle to be able to maintain our mental health. Certainly another reason why we are more stressed and why we see an increase in mental health is certainly the COVID-19 pandemic. And I appreciate this slide because this slide was actually pulled from a study that was done in 2020. And so you think about that, even just with where we were at in the pandemic at that time, already at that time, when they looked at adults reporting symptoms of anxiety and depressive disorder during the pandemic by age, you can see here 29%, 39%, 48%. From ages 18 to 24, 56% were reporting depression and anxiety symptoms. So just think about that. I try to put it into context, that if you think about, you know, the next time that you are at a community gathering, likely, right, we know that before the pandemic, we would always tell you that probably 1 in 4 or 1 in 5 are struggling. Really, with the pandemic, we're seeing a much greater number even than that. When we look at data, the mental health crisis in America, the data is certainly not good. And I won't bore you with every one of these, but I want to call out just a few of them. 11% of adults who identified with 2 or more races reported thoughts of suicide. Just think about that, 11% of people. 56% of adults with mental illness received no treatment. So when you think about that, think about if 55% of adults who were having chest pain didn't get treatment, what is going to happen, right? You see it in your world, that's likely going to result in a heart attack. And the same thing happens when we don't treat mental health. The symptoms don't just go away. Instead, the symptoms are typically going to just continue to elevate. 28% of adults with a mental health illness reported that they were not able to receive the treatment that they needed. Again, when we just look at overall these numbers, we see that the data just continues to show that the needs just continue to rise. What does this data say for first responders? This is from resiliencyfirst.org. They said that tragically more first responders die by suicide every year than die in the line of duty. And many of you are obviously doing a lot of life-saving work, but also doing a lot of, at times, very dangerous work. But yet where we're actually losing more first responders is actually by suicide. So if we know that we are struggling in a complex world, what can we do to protect our mental health? The first thing we can do is educate, and that's largely why we encourage and appreciate having the space to have these conversations like we are tonight. Because when we educate ourselves about mental health conditions and challenges, it helps us to be more aware, to be able to identify it ourselves, but also to be able to help to identify it in someone else. It's important that we continue to encourage a culture that acknowledges mental illness and supports those who may be experiencing it. And this is what's really difficult, I would say, because I've now worked in mental health for 15 years. And what I would tell you when I started is that when we looked at stigma 15 years ago, it was definitely present. And probably where I saw more of it even at that time is people at times were still judgmental of those who were struggling with mental illness. In 15 years, I'll tell you, we've made a lot of progress in that I think we judge other people less, but I do think, unfortunately, there's still a lot of judgment that we cast on ourselves when we ourselves are struggling. Meaning, I think we've come a long ways that if I find out that my neighbor has depression, a lot of times still, I see a lot of people who are able to look at that neighbor with empathy, with support, and letting them know that it is certainly okay. Where there's still a lot of challenge is it okay that I myself have depression? Or when it's I myself, do I begin to look at it like a weakness, like something that I should be able to just get over? Do I begin to look at it like, well, if other people don't have this, why the heck do I do? What's wrong with me? I'm just broken. And I don't make up those words lightly. I hear those words in the work that I do every day. So while I think it's great that we've made a lot of progress in trying to challenge the culture of how other people see this, I would challenge that we still have a lot of work of how we see ourselves when we ourselves are struggling. And with that, we really need to encourage people to continue to reach out for help. What's difficult about this is that, contacting my neighbor and saying, hey, I broke my hip, I really need some extra help right now, isn't something that probably there's a lot of shame associated with. When I have to call my neighbor and say, my anxiety is so high right now, I can barely have the energy to get off the couch or to be able to cook meals. Can you come over and help with my chores right now? That seems a little bit different. And I certainly hope that I live in a world that someday that doesn't feel at all different, but for many of us it does. And so what we really have to encourage is letting people know that just like it's okay to reach out for help if you have a physical illness, it's equally okay to reach out for help if you have a mental illness. And then with that, what we're going to talk about tonight are what are some maybe smaller things that we can do to try to practice self-care. So what I would like you to think about, and if you're comfortable, I'd actually encourage you to either unmute or if you just want to type in the chat, I'd be very fine with that as well. That how do you do at practicing self-care at work in your current state? A 0 would be poor and a 10 would be great. Seven, 6, 8. Very good. So it's good to hear and see. I appreciate there's a 0 out there, so there's a 6 out there, so we got a little bit of a spectrum. But with that, I also want to hear from you kind of with your self-care at work. What gets in the way? What makes it hard for you to be able to pause and take care of yourself when you're at work? If you wouldn't mind just typing that in the chat. Interruptions, absolutely. Schedules, the tasks that I need to complete, the appointments, the phones that continue, just the number of activities that I need to complete. Absolutely. So then I ask you, if you think about your self-care at home on a scale of 0 to 10, what would you rate yourself at practicing self-care when you're at home? Eight, 9, 7, 6. So we certainly see that maybe for some of us, it may be a little bit easier at home, but still, certainly it's still difficult. And what do you think gets in the way of you practicing your self-care at home? Lazy, family, chores. I'm going to rephrase that lazy. That reality is we're just tired, right? when we're working, some of us as many hours as probably what you're being asked to complete, it's hard to have the energy to think about doing something to take care of myself. I have tasks that need to be completed. There's too much that's happening. There's duties, just the requirements of life. If I pause and go take care of myself, who's going to do my laundry? Who's going to make the meals? Who's going to do the chores? Yeah. So that's what we want to talk about next, is just kind of about some of the barriers. But I also want you to think about, you're going to see tonight, I like a lot of different analogies, and I want you to kind of think about just what happens if we don't take care of ourselves, okay? So physically, we know that if we don't take care of ourselves, we can have short-term effects from the amount of stress that each of you are going through. And that short-term effect can sometimes look like faster breathing, faster heart rate, dry mouth, sweaty palms, tension in your neck and shoulders, nausea, constipation, and diarrhea. And I try to kind of challenge people, if you think about your body and your mind kind of being like a car, that's essentially when your check engine light is coming on, right? And it's saying to your body, hey, you better pause, you better maybe think about trying to change course here. But for some of us, we kind of just look past that short-term effect and say, oh, things will get less stressful, I just got to keep going. Who else is going to do it? I got tasks that need to get done. And we ignore that check engine light, and then it begins to turn into long-term effects, where we see high blood pressure, headaches, dizziness, excessive sweating, nervousness, neck and back pain, rashes, allergies, ulcers. So again, if we don't pause and take care of ourselves when the check engine light comes on, essentially the car begins to break down. And physically, sometimes what this looks like is where I have a cold all winter that I just can't get rid of. Well, why can't I get rid of that cold? Potentially because the amount of stress that my body is under, it is difficult for my immune system to fight it. For some of us, this is where we kind of ignore the fact that we're not feeling well, and maybe I need to pause and take care of myself, and pretty soon we're on the couch for 7 days with the flu, right? Now, naturally, illnesses are going to happen at times, but what we do know is our bodies were not meant for the amount of stress that we're sometimes putting them through. I talk about how can it affect us physically, but certainly it can affect us emotionally as well. And so when I talk about anxiety and depression, a lot of times when I ask people, what is anxiety? A lot of times people will say to me that anxiety is worry and depression is sadness. And both of those statements are true. But what I would also say is that there's other symptoms of depression and anxiety that are sometimes harder for people to recognize. So anxiety is essentially experiencing intense fear of a specific thing or a situation. And that anxiety is at the point where that fear is making it difficult for me to function. So maybe that anxiety is so high about what people are thinking about me or judging me that I'm beginning to withdraw from social situations. Sometimes people have more what we call generalized anxiety, where they just have like this intense anxiety about kind of many aspects of their life, even though logically there's maybe not something to be worried about. We see sometimes people have trouble sleeping, increased headaches, stomach aches, or fatigue. And then we also see more irritability. And this is common not only with anxiety, but also common with depression. Any ideas why that might be? Why do you think when people are struggling with anxiety or depression, why do you think we sometimes see more irritability or more anger? And you can type it in the chat if you have a thought. Yeah, that feeling of being out of control, right? It feels like I'm just adding to the stress. Absolutely. Some of it is in our world, anger and irritability is sometimes easier to talk about than depression and anxiety. So if I come to work on Monday and somebody says, hey, how are you doing? And I say, oh, I'm so angry because this weekend my husband didn't do this or didn't do that, that's somewhat socially acceptable. But when I come to work on Monday and somebody says, hey, how are you doing? And I say, gosh, I've just been so depressed. I'm just so sad. I'm crying a lot. I just can't even quite describe why. That takes a lot more vulnerability. And so many times people will be able to show kind of a secondary emotion, we call it, of anger, as compared to being able to kind of identify or call out that anxiety and depression. And just like stated in the chat, completely agree that sometimes that irritability comes just because they feel very misunderstood, right? Sometimes people look at somebody with depression, and even though we've made a lot of progress with the stigma, sometimes it still feels like people just don't quite understand what I'm having to fight through right now. And when we think of depression, again, a lot of times people think of sadness, but other symptoms of depression that we see is just unable to find enjoyment in things that they once did. And this is really hard because I just recently met with a gentleman who he wasn't finding joy in spending time with his kids and his grandkids. And this guy loved his kids and grandkids. And so he had such shame about how does somebody not enjoy that? Well, somebody who doesn't enjoy that is somebody who's struggling with depression. We see changes in eating patterns. Sometimes people will eat more and sometimes people eat less, just like with sleeping. We'll have sometimes people, all they want to do is sleep, and some people struggle to sleep. We see changes in energy. We a lot of times see people isolate a lot more often. And actually for the reasons that were kind of called out on the chat, sometimes people isolate more because they feel like they're misunderstood. Sometimes it feels like they're kind of a burden and they don't necessarily want to be around other people. The difficult part with that, though, is that isolation, if you think about it, really feeds depression. Because think about the last time that maybe you were really sad or really overwhelmed. When you spend a lot of time alone, a lot of times our thoughts actually begin to ruminate even more. And with that, then those thoughts begin to affect how I feel, and I start feeling more depressed. And then I'm more depressed, which makes me want to isolate more, but the more I isolate, the more depression grows. So even though isolation is sometimes what people with depression want to do, when we do that, it actually intensifies often the depression. We also see difficulty paying attention or concentration or focus. This is what makes work sometimes really difficult. And with that, if it goes untreated, right, just like if you think about these symptoms, many of them are sometimes like that check engine light saying, hey, I think there's something going on. When people ignore that and say, nope, I'm not going to deal with that. I just need to get over this. I'll be fine. That's when sometimes people begin to have suicidal thoughts because the condition's not improving because we're not treating the condition. And with that, we sometimes see people begin to have thoughts to end their life. So many of us, I do think, would agree that it's important to practice self-care. But next, I want to talk about just some of the barriers that maybe make it difficult. One is just how we see self-care. So this definition on the screen says self-care, the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. This is from the World Health Organization. The reason that I love this definition is because it talks about promoting health, preventing disease, maintaining health, to cope with illness and disability. So what I love about this is that I don't see the word selfish in there at all, right? But yet sometimes when people think of self-care, that's what they think about, right? Like, how dare I pause and take care of myself when there's all these other people who need me? The reason why we want to practice self-care is, as shown on the screen, there are many benefits to practicing self-care. We have a greater capacity to manage stress. We reduce symptoms of mental health. We maintain positive connections, and we are better able to achieve our goals and our potential. Another barrier to self-care for some people is the caregiver mindset. It's more important to help others and I'll be okay. And what I would challenge you is this: if this is you, which recognizing that some of you are in a field where you're asked to be a caregiver, sometimes those of us who do that professionally, that's also the role that we play in a lot of our personal relationships, that we're kind of known as a person who's always there for people. We're willing to help out in any way. And what's great about that is our world needs people like you. The difficult part with that is if you think about yourself like a cell phone kiosk, okay? If you think about that, you are that kiosk on the picture right there. Many people come to you throughout your day, throughout your week, asking you to charge them, right? Your coworkers are maybe saying, hey, I need your help. Can you help with this? Your spouse is maybe saying, hey, I need your help. Can you help with this? Your kids, maybe your parents, your sisters, siblings, your community, right? There's many times that we are being asked to, hey, can you charge my battery? Can you help charge my battery? And that is great to do, okay? But if we don't ever stop and plug ourselves into the wall, we are not going to be able to continue to charge other people's batteries. So if your mindset is that it's more important to help others, I would also challenge that mindset by saying, and if I don't ever pause and take care of myself, I'm not going to be able to take care of others. Another barrier that I sometimes hear from people is I should be able to cope. And I probably hear this more, especially from males, that they will tell me that they are strong. They are the people who are supposed to be able to deal with all of this stuff. And with that, what I would challenge is that if we talk to ourselves instead, like we would talk to a friend, I think that conversation would be very different. So if my friend called me today and said, gosh, I've been so stressed, I had a really bad call last night and I've been struggling to sleep. And so when I got home, instead of making supper right away, I went for just a 5-minute walk just to try to help to reset. I don't think I would say back to that friend, gosh, you should be able to cope. I can't believe that you did that. Instead, I would probably say to that friend, good job. I'm proud of you. Let me know how else I can help, right? If I had somebody say that they have been so stressed lately that they are struggling and they think that they need to go talk to somebody professionally, I would tell them, good job. Please let me know if I can help. Instead, sometimes when we maybe even have that thought in our head of, hey, maybe it's time I go talk to somebody about what's all going on, sometimes those shoulds start to come in of I should just be able to get through this though, right? And especially probably based off of some of the work that each of you are in, sometimes we begin to compare ourselves to other people, right? And we kind of look at maybe some of the situations, the traumas that we've seen other people go through, and we tell ourselves, gosh, if they can handle this, I certainly should be able to. But would you say that to a friend, right? Would you even say it to your colleague? Probably not. To your colleague, you would say, I hope you do go talk to somebody and let me know what I can do. So if you are one of these people who put a lot of these shoulds on yourself, I would challenge you to try to talk to yourself like you would a friend. I actually say a lot of times it's like the golden rule reversed. The golden rule, of course, is we want to treat other people the way that we would want to be treated. But I would challenge some of you as caregivers probably also have to think about that the other way, that I need to treat myself the way that I treat other people. Another barrier to self-care certainly is time. And some of you mentioned this as one of your barriers. I need to do A to Z first. Well, I don't know if any of you are like me, but at times I run out of gas. And I am an adult, and so it is pretty ridiculous that I do this. But the reason why I've run out of gas from time to time is because I don't want to take the time to stop and fill up with gas. And I wish I could tell you my car doesn't have like the nice signal that tells me that you're running low on gas, but it does. And sometimes when that little warning comes up, I just push dismiss, which is ridiculous, right? Because everybody logically would listen to that and say, but you know what is going to happen. If you don't take time to fill up with gas, your car is going to quit working. But I would say that that same thing happens with our bodies, right? With our mind, is that none of us want to stop and take time to take care of ourselves, right? We'd much rather be getting other things done, being more productive. But what I would tell you is that if you don't stop and fill up with gas, eventually your car is physically or emotionally going to stop working. Another barrier to self-care is certainly competing priorities. There's too many other things that I need to get done. And what I would challenge you, if that's you, is to think about rest as being as a catalyst for productivity and not necessarily a break from it. So in our world, sometimes when we tell somebody that we took a break, right, that we rested, we sometimes look at that as like, oh, but you could have gotten other things done. Research would actually tell us that when we actually pause and take care of ourselves, we're actually more efficient, we're actually more productive because we have the energy to continue forward. The other thing I would challenge you is that if the competing priorities is a big challenge, can you pair a self-care habit with something in your regular routine so that it becomes automatic? So for example, I take the elevator at work more than I should, okay? I definitely probably should take the stairs more often, but I take the elevator. And I used to always use that time that I was like, gosh, I could probably get at least 2 emails done or deleted during that time. I've had to challenge myself that that's a part of my routine already, is using the elevator. So what can I do to take care of myself when I'm doing that? So rather than trying to be efficient and get something done, I challenge myself to use that time to focus on gratitude, to think about things that I'm grateful for. If you're a person who's obviously having to commute to and from work or to and from calls, instead of looking at those calls, that commute is a time where I have to check in with my family and see how they're all doing and check in with my mom and see how she's doing. Those things are important. But can we also use that time at all to take care of ourselves? That I listen to a podcast that helps to fill my cup, or I do some deep breathing that helps me to fill my cup. Are there small things like that when you already have to get these tasks done that you can pair a self-care habit with? Another barrier that I hear sometimes is my mentor works 60 hours a week and I want to be like her. And I recently was listening to the radio and I heard they were talking about a research study actually that they looked at families where parents ate carrots. They saw that kids in those homes also ate carrots, but they saw that in families where parents didn't eat their vegetables, the kids were more likely to also not eat vegetables. Why does that matter at all? Because if you are a person that has people who are looking up to you in any way, okay, maybe it's nieces, nephews, grandkids, kids, and you tell them, if you're ever struggling with your mental health, I want you to go get help. But yet they never see you as a person that if you're struggling, if they see you as somebody who refuses to go get help, we know that they're going to be less likely. If I want my kids to learn a balance of being able to take care of others and a balance of being able to take care of themselves, but they see a mom who never pauses to take care of herself, the likelihood of them taking care of themselves and being able to be resilient in this complex world is going to decrease. So what I would challenge you is that if your mindset is that if I take care of myself, that's selfish, I would challenge you I want to change the culture, right? I want within our department, within our squad, I want it to be okay, that it is okay to stop and go for a 2-minute walk, that it is okay to stop and take deep breaths. If I want my kids, grandkids, nieces, nephews, the people who look at me and have respect for what I do, to see that it is okay to take care of myself, I need them to see it, right? Me just saying it isn't going to change it. So let's just talk about a couple ways that we can practice self-care. There's lots of different kind of visuals that people use when they talk about self-care. I try to keep it simple, and so I try to focus on kind of 4 different areas that we can think about. How can I take care of myself spiritually? How can I take care of myself physically, mentally, and emotionally? So mentally, okay, I want you just to think for a moment here. I want you to think about 3 things that you are grateful for. I'm just going to give you like 15 seconds, and I want you to think about 3 things that you are grateful for. All right, what I just asked you to do was to practice gratitude. What we know is that when we practice gratitude, even just pausing and thinking about what we're grateful for, it allows us to improve our physical health, it improves our sleep, it improves our psychological health, increases empathy, enhances self-esteem, improves mental strength, more social connection, reduces aggression. When you think about that, those are some pretty great benefits from something that doesn't take a lot of time. So what I would challenge you, okay, is maybe one small thing you can do to practice self-care is to build in gratitude practice. Maybe it's that every day when you get to your site that you pause and you think about things that you're grateful for. Maybe it's when you get out of the car at night that you tell yourself things that you're grateful for. Maybe it's that every meal, okay, that after you finish eating, that you begin to teach the people in your homes this gratitude practice by pausing and thinking about what we're grateful for. Again, it doesn't take a lot of time, but what we know is that doing some of those small things can make an impact in our mental health. I would also encourage you, as I talked about in the beginning, to monitor your social media use. And so what we know with social media, like I said, is that, yeah, there are benefits because it can help us to connect. But I would also challenge you, knowing the mental health impacts of social media, are there some limits that we can set? Maybe it's limiting the amount of time, okay? So when I think about just the work that you guys do each day, you are already exposed to a lot of trauma because of the servant part that each of you have in the roles that you are playing. With that, social media also sometimes is sharing even sometimes the same stories that you were a part of. And with that, that can certainly impact our mental health. And so are there some limits that I have to set? Maybe it's unfollowing certain sites. Maybe it's unfriending certain people. Again, these are sometimes small things that we can do that don't take time. It would actually increase time other places in our life so that we can better take care of ourselves. It might be seeing a professional. So there's a podcast actually by Kate Pieper called Responding with Resilience. And I appreciated what she said. She said, resiliency is not about just bouncing back, right? That's a lot of times kind of how we see it. But you don't just bounce back from trauma. The incidents may change you, but it can change you for the better, and it can give you a strength that families and individuals that don't go through these situations can experience. But we have to develop skills that help us to normalize feelings. Notice it doesn't say skills to avoid feelings after incidents and critical events, right? But rather skills that normalize the feelings about the incidents and the critical events that we go through. And I personally believe that just like if somebody has a knee injury, do I think that they can look at a handout that tells them the stretches that they need to do and they could figure that out? Yeah, I think they could probably. But yet we still have them go to physical therapists. And the reason why we have them go to physical therapists is that physical therapist is there to guide them, to help them, to monitor their progress, sometimes to tell them, hey, they need to take a step back here. The same thing is true with mental health. Do I think each of you are able to read a post, to read a blog, to learn about the importance of talking about your feelings on a website? Yeah, I fully believe you're all capable of that. But what I would tell you is that seeing a professional is where it allows us to have the space to release some of these feelings, to talk about what you're going through. And so for some of you, the best thing maybe that we can do is consider, is there a professional that I could talk to? An emotional self-care habit that I could do is look at setting limits. And so setting realistic boundaries and then being consistent with those boundaries. And when I talk about boundaries, I a lot of times talk about my dog Bella. So when Bella lived with us, we had an electric fence, okay, because I live on an acreage, and Bella liked to go over to the neighbor's house. One thing that was important with our electric fence is that it was consistent, right? If one day I turned on the electric fence and one day I turned it off and the next day I turned it on, for Bella, it's going to get pretty hard to understand where is the boundary on this farm. Instead, I had to keep it consistent. And for some of us, when we're setting boundaries, that's an important piece to think about, right? If I'm trying to set boundaries better with like my friends, is that you guys already go with a lot of nights without great sleep, right? That if I'm trying to set better boundaries of that, okay, after 10 p.m., I'm not going to be able to answer the phone. But then some nights I do pick it up at 11. Some nights I do pick it up at midnight. When I talk to them the following morning, I usually apologize that I didn't pick up the phone. That's setting inconsistent boundaries of what boundaries I need to set for them to be able to learn to respect. So being consistent with our boundaries and limits that are important, but then also with that, let's expect the discomfort, right? Because many times if you are a yes person, right, so they know that every time that they contact Carl, that Carl always says yes, right? The first time that Carl says, no, actually, I can't help you because I was out all night on a call and I need to sleep, typically the response back isn't, oh, you're just like, that's so great that you're taking care of yourself. Instead, it's like, oh, really? You can't help, right? Sometimes it's a little bit of, what's wrong with you, right? Did something change? So expect the discomfort that when we say yes, people usually praise us, right? And they tell us how thankful they are for us. When we have to set limits and we say no, it usually we don't get that same response back. So when I talk about boundaries, I want you to remember that expect the discomfort. So I would encourage you, okay, that when we talk about these self-care patterns, right, whether it be practicing gratitude, thinking about seeing a professional, setting boundaries, I want you to try to continue to think about what is something that maybe I could take away from this presentation. And you don't have to do these all because you won't do it consistently then. But if you are a person who struggles with boundaries, maybe just think about one boundary that I could begin to set for myself to protect my mental health. Another thing that we can do is to practice deep breathing. And so what we know about taking deep breaths is all of the benefits that are listed on the screen. What I also know about deep breathing, though, is many of us really stink at doing it, okay? Because when people tell us to take deep breaths, many times we actually hyperventilate, right? We actually take such short, shallow breaths that it's not resetting our body physically. The other thing is some of us are multitaskers. So sometimes even when people tell us to stop and take deep breaths, we're actually still thinking about everything we need to get done while I'm taking that deep breath. What I would challenge you is there's different methods, but one of the methods that I teach probably the most is called 4-7-8 breathing, where we breathe in for 4 seconds, we hold it for 7 seconds, we breathe out for 8 seconds. We breathe in for 4 seconds, we hold our breath for 7 seconds, we breathe out for 8 seconds. There's actually research that has looked at 4-7-8 breathing, and doing 3 cycles of 4-7-8 breathing can be as effective as some of the quick-acting anti-anxiety medications because our body is physically resetting as well as psychologically resetting. So this is a skill that I would say is a great skill that we can try to do and teach. So my kids, okay, I got a 7-year-old boy and a 9-year-old boy. Both of them practice doing deep breaths like this because I want them to be able to use deep breathing when they're overwhelmed, when they're anxious, right? So it's a great skill because I can practice my own self-care by doing it while teaching it. It's actually a skill that I use a lot of times with patients. Like when I see them overwhelmed, sometimes when they get overwhelmed, I start to get overwhelmed. Sometimes myself just stopping and doing 4-7-8 breathing helps me in that moment, and it helps them in that moment. Maybe for you, a way that you can practice self-care to build up your resiliency is thinking about your physical health. And as I said, I have 2 boys. And if I told you that I told my 7-year-old that if he doesn't get good sleep at night, that's not a problem. Just drink energy drinks in the morning. If they don't get 3 meals a day, not a problem. Try to grab a protein bar if you can. If you don't get good sleep Monday through Friday, not a problem. Just sleep till noon on Saturday. You would probably look at me and say, that is terrible parenting. But yet, that's how many of us parent our bodies, right? We a lot of times look at sleep as very optional. Energy drinks can make up for it, right? We sometimes look at, again, routine, structure. Kids need that, but not us as adults. Research would not tell us that. Do I expect you to make big changes in this way? Absolutely not. But are there small things that you can do to try to better take care of your body, either with nutrition, exercise, or sleep? For some of you, it's maybe spiritual self-care. Maybe it's journaling, meditating, or praying, spending time in nature, finding belonging in your community. The thing I would say is just that prioritization is going to be key. And in order to say yes to your priorities, you sometimes have to be willing to say no to something else, and that's what's really hard. But everything can't be a priority. And if you make everybody else's priority your priority instead of your own, there's that quote that says you can't pour from an empty cup, right? And some of us are constantly giving the coffee to everybody else, but then wondering why we're struggling. Because if we say yes to everybody else, but no to ourselves, it's hard for us to continue to try to pour into others. Maybe it's just creating for yourself a 5-minute drill. That do 3 deep breaths, 4-7-8 breathing, recite a positive affirmation, smile. It doesn't take a lot of time, but a small thing I could do throughout my day, throughout my shift to help me to try to reset. Again, maybe it's being willing to ask for help professionally or being asked or considering reaching out personally. We know now nationally, all of us have access to 988 anytime. And so if it's because you can't sleep at night, if it's first thing in the morning, we can all call 988 anytime to reach out for professional support. I personally think that in South Dakota, as I get to know more about how other states have operationalized 988, we should be really proud of our state because I think they've done a phenomenal job. And I think with that, it's a good reminder for all of us that 988 can be used for us too, right? A lot of times we talk to people about using that number, but we can use it too when we need it. Overall, many of you know how to practice self-care, right? You know some things that you can do to take care of yourself. What I would challenge you is I hope that there's something that you take away from tonight is that an important reminder of why we need to do it. So when you think of next steps, I would encourage you, okay, if there's something that you could take away from this that you would say, yep, I'm going to try practicing 4-7-8 breathing. Yep, I'm going to practice trying to prioritize my sleep, or I'm going to practice setting my limits. Whatever your self-care strategy is, maybe it's going for walks, maybe it's spending time out in nature, maybe it's spending time in prayer or meditation, whatever it is. What I would challenge you is to try to put it in your schedule in some way. If you are a person that operates on an electronic schedule, put it in there. Paper schedule, put it in there. Partly because if you put it in your schedule, then when you are working on trying to prioritize this, when somebody calls and says, hey, I'm wondering if you can help me move on Saturday, but you had put on your schedule that every week on Saturdays, you're going to try to spend an hour out in nature, then even if you end up saying yes, you are having to intentionally cross out or intentionally take out your self-care versus just this passive change of just continuing to take care of others. So I'd really encourage you to put it in your schedule. Maybe it's setting an alarm on your phone, right? So that every day at noon, 4-7-8 pops up on your phone, and that is your reminder to stop and to take some deep breaths. Maybe it's putting a reminder of every Thursday, it pops up in your phone, Thankful Thursday, I'm going to focus on gratitude. What is something small that you can do to put into practice? I like this little cartoon because it says, I'm learning how to relax, doctor, but I want to relax better and faster. I want to be on the cutting edge of relaxation. And it sounds kind of ridiculous, but that's sometimes kind of how we look at this stuff, right? Like, okay, I heard this, I'm going to go and do it. I'm going to go do it big. Self-care is a process. So I would encourage everybody, whenever I talk about this, I want people to think about what is something that I can do small, because if you're able to make small changes, you're going to probably be able to do it consistently. If we try to do too big, right, a lot of times we end up just kind of going back to our old habits very quickly. I appreciate this quote. It says, self-care is not self-indulgence, it is self-preservation, okay? And when you think about that, right, I have to continue to make choices to continue to preserve my physical health. And the same thing is true to my mental health. I can't imagine what each of you go through in the work that you do. And with that, I really want to encourage you that if you think about yourself like a cup, right? And you think about just you being that cup, constantly throughout your day, you are constantly pouring out, right? And I would challenge you, we have to continue to be more intentional so that we can be resilient, so that we can continue to do the work that you're doing by looking at prioritizing myself so that I can continue to take care of others. At Avera, we do have a behavioral health navigation team, and that's actually the team that I serve on. And so our team is bhsnavigator@avera.org, or my email is listed there. But we want people to know that if at any time you want to reach out, that you're saying, I think I need to get set up with a counselor, or I think I need to maybe talk to a therapist or see somebody about medications, that navigation number people can reach out to any time. Now that's only answered Monday through Friday. And so certainly please reach out if it's non-emergent. If it's emergent, remember 988, or if it's emergent, please go to your local emergency department. But non-emergent, please don't hesitate at all to reach out for help. So with that, Michaela, if you wouldn't mind maybe stopping the recording, and then I would just like to pause